Hello, I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, IVFcentre Pune. Let us talk about the relevance of test tube baby technology in patients with recurrent pregnancy losses. Now, we know that there are many couples who conceive naturally but however miscarry either in the first or the second trimester. Most of the times, the tests which are done in order to find out why they miscarried are most of the times absolutely normal, and here comes the main cliche in which can these patients be helped by assisted reproduction technology. Whenever we see about their miscarriages, sometimes some patients have a bleeding episode and then they miscarry. Some patients have pain in abdomen followed by miscarriages, but there are a subset of patients who are absolutely without any symptoms. They go for a regular visit to their obstetrician, and on doing the sonography, it can be found out that the heartbeat is not there, which is known as missed abortions. Now, in these patients, can we help them by assisted reproduction technologies like IUI, IVF or ICSI? Now, whenever we screen these patients, we take the history in detail, we see all the previous reports, we see various tests which are done in order to find out the cause for the miscarriages, and in case everything is still normal, in patients who we always perform a hysteroscopy in such patients. Sometimes some patients have a uterine defect which can be a uniconvulate uterus, a biconvulate uterus, a septate uterus which can be there since birth. Some patients like those which are having infections like tuberculosis, chlamydia, bacterial vaginosis, etc. They can be very well helped in the sense the antibiotics are given, the patient is recovered, and then she is taken up for assisted reproduction technologies. Sometimes even the DNA fragmentation of the sperms is very high. It can be a sperm infection, or immunoantibodies from the sperms can be the main cause for rejection of the baby. So all in all, in-depth study of what is the reason for miscarriages is done, including the genetic analysis like the karyotyping of the male as well as the female. In such patients, whenever we try to help them with assisted reproduction technology, the baby is formed with ICSI, we culture the blast till the blastocyst stage. We find out whether the babies are growing as normally as any other embryos of the other patients, whether there is any growth lag or whether there is any fragmentation in the embryos or any kind of an abnormality in the form and the structure of the embryos is keenly looked for. If the embryo looks perfectly normal, then it can be transplanted later by the frozen embryo transfer technology, which has given solace to many couples who have not miscarried after IVF or ICSI. However, certain other artificial medicines are extremely important, like low molecular weight heparins and various other medicines to continue the pregnancy right up to term. Sometimes we also find that certain embryos do not do well in IVF ICSI who have miscarried earlier, and such patients can be helped out with the help of donor egg program or a donor sperm program by the legal methods. And these donor programs in the same mother have also helped a few couples to take the pregnancy till term and deliver a normal healthy child. Thank you.